Hello, I'm your host, Dr. Braha. Welcome to the Zermed Show. On the show, we will feature local physicians and healthcare leaders who are experts in their respective fields and who will share their experiences and wisdom with us. We cover a broad range of health topics on the show, and today we have Dr. Maggie Tetrokalashvili, Chair of Obstetrics and Gynecology at New York City Health and Hospital's South Brooklyn Health. Doctor, welcome to the show. It is really nice to have you to talk about women's health today, which is a very, very popular topic for our viewers. So before we delve into the world of women's health and obstetrics, gynecology, prenatal planning, let's talk a little bit about you. Tell us where you're from, your training, where you've been to learn about medicine, and especially your specialty in obstetrics and gynecology.
Thank you. First of all, I'm privileged, honored to be here and to represent our amazing department. Thank you for having me on the show.
Oh, it's a pleasure to have you.
Thank you. A little bit about myself. As every New Yorker, I consider myself the citizen of the world. Born in Republic of Georgia and did my medical school at the Moscow State Academy, and then did research fellowship at NYU, the residency at Mount Sinai, Queens General Hospital program. Then traveled to Case Western Reserve to do fellowship in fertility and reproductive endocrinology, and came back to New York. And I'm here for a few years, proud to serve our community, and 3 years at South Brooklyn Health, leading the amazing team of physicians, midwives, physician assistants, nurse practitioners,
the whole team.
I can go on and on with
care.
Nurses,
yeah.
Yes, amazing nurses, and having a fabulous team that delivers care to very complex patients. We're a referral center to those, whether it's maternity health or gynecological patients. We are, again, our door is open to everybody.
Yeah, women's health is a very large breadth of medicine. It's a large area with OB-GYN, so obstetrics, pregnancy, delivering babies, gynecologic health, ovaries, the uterus, cervical health. And so you really have to have a team that you supervise here, and you're the head of the OB-GYN department.
Yes.
Tell us a bit about the services you offer here to start off with for the women watching. What are the OB-GYN services that are available in the hospital, as well as ambulatory care outside the hospital in the offices?
Sure. Let me start with maternity health care. I'm blessed to have 2 children and be a mother myself. So when we talk about women's health or maternity or OBGYN, we always think this is delivering babies. And my husband always jokes that he's a critical care. So he says you help bringing babies or people to the world, and I'm trying to hold on to them. So when we talk about maternal health care, certainly important is an early access.
Getting into your facilities early, even before someone's pregnant.
Correct. So when we talk about prenatal care, it probably starts even before a woman is pregnant.
The planning stages.
Stages. If we think about pregnancy, the first 12 weeks is the most vulnerable time when anything can affect early pregnancy and have consequences later on, like preterm birth, right, early deliveries and complications. So having an opportunity to control those, whether there is a disease, or offer immunizations, vaccinations, especially today with COVID, when we look back and see is there any effect of COVID on pregnancy, we see earlier deliveries, we see higher risk of morbidity. So being able to offer those vaccinations, including COVID vaccination early. The pregnant patients, let's say, have seizure disorders or mental health disorders, to be able to control the medications and adjust the medications to make sure that the most vulnerable time is safe and leads to safer pregnancy as it goes on. So early access, of course, is very important. We are proud to have phenomenal faculty the high-risk specialists, maternal fetal medicine, the midwifery service that has a very holistic and personalized approach to patients, and a great team of residents. It's an educational program. So we're here as a team. Every day we round on the patients, each single patient, and discuss every patient to make sure everybody gets very individualized and safe and high quality care.
Yeah, so you mentioned very important that early access, the planning period, even before someone's pregnant, to consider seeing an obstetrician, to plan pregnancy, to go into pregnancy as healthy as possible. But you mentioned that early marker, that first 12 weeks. Many women don't even know they're pregnant in a large portion of those first 12 weeks.
Right.
So tell us, for our women out there watching today, when should they go in and see a gynecologist or an obstetrician? When should they start routinely getting examined?
Sure. When we think about women, they really start at infancy, right, and going into the puberty and then womanhood. As an OBGYNs, of course, we start seeing patients 18 years old and above, but often mothers come and they bring their daughters with menstrual abnormalities of menstrual cycle or contraception, or, which is we are very lucky that we provide access to patients with unwanted pregnancies in terms of the abortion care. Which is very important. We want patients to be pregnant, but we want wanted pregnancies, not unwanted pregnancies, to be able to counsel them and really provide the contraception of their choice, or being able to help them and really empower women in knowing their disease, educating them, and understanding their body. And the body is the entire body. Starts with mental health and having all the services that are available in case it's not healthy women that we always imagine, and but to be able to refer them to other services, that's very important. To give them vitamins, right? When we talk about prenatal care, we talk about folic acid to prevent the neural tube damage, and certain just make sure they're healthy. There are iron supplements to make sure they don't have low hemoglobin. So that's all of that is extremely
very important early on.
Early on. Right.
Once someone is pregnant, they come in to see you or one of your physicians here. What is it like? How does the process start with a new pregnancy?
New pregnancy, we take a very comprehensive history of pregnant patients. We review all their health issues, all their medications, and depending on the acuity, on whether it's a high-risk or low-risk pregnancy, we schedule follow-up appointments. We provide access to frequent appointments. And we know that some pregnancies are challenging, and not everybody who comes is coming from rich resources, but really poor resource communities. And we are very proud to have an excellent maternal medical home that follows patients not only throughout the pregnancy, but even after the delivery. So one of the things that American College of OBGYN advocated and is very proud of is to have the coverage for care after delivery, not only for just 6 weeks, but really entire year, because morbidity and mortality is associated with pregnancy doesn't stop with the pregnancy. Sometimes it continues way past the pregnancy. So to have an amazing maternal medical home, and by the way, have not only the certified social workers, but also specialists from behavioral health that follow those patients and provide them with access, whether it's help with reestablishing themselves at work environment, or providing with food, housing, all that is comprehensive care is available to our patients.
Going into the pregnancy and leading out of after delivery. Correct. And taking care of the mom for quite some time after. Yes. It's very important for the viewers to know that it's going into pregnancy, it's very important, getting through the pregnancy, but also after. The support, it doesn't end when you go home with the baby 2-3 days later, but for the year, you're saying, after, to continue care. For women that are watching today, for services in terms of fertility, for help getting pregnant, you offer support here. Tell us a bit about that, and for our viewers who are watching, how should they reach out? What should they do if they're, say, trying to get pregnant, having a hard time?
Right. This is the topic very close to my heart.
Yes.
And certainly it's the topic of the entire talk. But the main message that I probably want to send is to, again, seek help early. Because sometimes women are young and consider themselves young at any age, but reproductively speaking, our eggs or our ovaries age, and the aging slowly starts after age 30, and after age 35, and after 40, it's already a very fast process. So we really want women who notice any abnormalities in their menstrual cycle, or probably we heard conditions like polycystic ovaries, right? I know many young girls, they have sometimes trouble finding decreasing their weight. And despite exercise and proper nutrition, they struggle with weight and hair growth and irregular periods. And conditions like polycystic ovaries, it's not just about fertility, but really the health, the long-term health, because there is a high association with cardiovascular disease, with even endometrial cancer, diabetes. So we want them in fertility clinic to counsel, to do the preconceptional counseling early on, to help with the treatment and medication. And also we work very closely with many established centers to provide assisted reproductive technology to those women, and also counsel them about long-term outcomes of infertility to their entire health.
Yeah, so PCOS is something we hear a lot about.
Right.
For the viewers today, what exactly is PCOS? How do you explain it to your patients when you tell them that they may have a diagnosis of PCOS?
Right. So as females, yes, we have female hormones, but we all in our human body both have female and male hormones, and sometimes there is an imbalance in those hormones, and you see the predominance of male hormones. That manifests itself as increased hair growth, acne, sometimes hair loss, also thyroid, the thyroid dysfunction, irregular periods, and increased BMI. But even women who have normal weight, surprisingly, they also can have polycystic ovaries. So if they notice again those irregular periods, increased hair growth, they, despite the normal weight, they can also qualify for the diagnosis of polycystic ovaries.
So there are some very common symptoms that we see.
On the ovaries,
right,
on the
so
ultrasound, which is not always consistent, but
not always there,
not
the cyst, but they call it polycystic ovary, even if there are no cysts.
Right.
But these are very common symptoms that women may have,
Right.
with the hair growth or the overweight. So it's very important for our viewers, if they're suffering from some of these symptoms, to come and discuss it with you or one of your doctors.
Sure.
At the hospital, when you're finally ready to come in and deliver a baby, tell us a bit about that process and what you offer here, and who's here waiting 24 hours a day, 7 days a week, I'm assuming?
Yes, 24 hours, 7 days. We have a faculty 24 hours, 7 days a week available. Also, something I wanted to mention, just to put the message also to the community, right? We talk about maternal health and maternal morbidity and mortality. We're very grateful that the leaders of the community and the Brooklyn Borough President, they realize that there are still inequities in terms of access to maternal health, in terms of the outcomes of the pregnancy. And when we talk about, for example, morbidity, the United States as a country, right, we're still struggling with decreasing maternal mortality, especially in New York. Providing the funds, we received $18.5 million grant from Brooklyn Borough President, Mr. Antonio Reynoso. We're very grateful to improve the maternal health care. So we're very excited that it's not going to be not only the new building, which is state of the art, and it's going to have the robotic surgery and GYN robotic, but also the entire maternal unit will be renovated, and it will be co-located on one floor. So you can imagine the patient that walks in and whether they need a prenatal care appointment or ultrasound and high-risk specialist, and they can go into the delivery room and postpartum. That will be the beautiful flow into the new building.
Everything's going to be in one area.
Going to be in one area.
That's wonderful.
Yes.
And this is helped by a grant from the Brooklyn Borough President, which sounds fabulous. An amazing investment into this important problem with morbidity, meaning illness or complications, and mortality, unfortunately death that can occur. And we know that that's higher in our community, in our area, and so you're fighting this and to help our women get through pregnancy safe, deliver safe, and have healthy babies and continue with their own health.
Yes.
A bit of obstetrics also includes gynecology.
Yes.
Gynecologic health, gynecologic cancer screenings, prevention. We talk about HPV vaccines, which is very important. Why don't we start off with that for especially our younger viewers, but really women of any age and men as well in terms of HPV vaccine, the human papillomavirus, which causes cervical cancer. Right. Let's educate our viewers a bit about that, because that's an ounce of prevention here.
Sure. Yeah. Of course, HPV virus is the highest risk factor in developing the cervical cancer in future, and I know that many viewers who have adolescent girls, maybe they're not thinking about prevention so early on for something that can develop later.
It's a vaccine
that
actually prevents cancer. It's a vaccine that prevents cancer by blocking the virus.
Yes, and the idea is really to have vaccination before exposure to sexual activity. So it's critical to raise the awareness, whether in the families or in schools, and really to educate young girls about safe sex practices, but also about the vaccination and prevention of the gynecological cancer. And if we talk about the screening tests such as pap smear, we always say, okay, it's age 21 that when they come in, but it's also important for young girls to come in before age 21, just to have a conversation with their gynecologist, what to expect from their future reproductive life. And I know this is the very sensitive exam, probably the most sensitive exam for women, and to have a very gentle approach, to have compassionate care, to have education available, resources available. It's very important for young women.
So just for the young women to just make an appointment with you or your colleagues to just meet.
Just meet.
Not because they have a problem.
Exactly. Yeah.
They may not even need to have a pap smear yet, but sort of like their health, advisor when it comes to women's health and safe sex practices and prevention, because we know that if we get this vaccine for human papillomavirus, the HPV vaccine, we can prevent cancers of the cervix, which is very hard to prevent once the human papillomavirus is present. So that's one part of screening and gynecologic health. What about ovarian cancer? Women are always worried about ovarian cancer. I know you really can't prevent it. You can check, or you can look. Endometrial cancers. What are we looking at these days? What are patients? What can they do to prevent this problem?
Yes. So certainly I want to mention that we do have all the services, including GYN oncology, including minimally invasive GYN service if the surgery is needed via small incisions and via robotic incisions, urogynecology service. But if we talk about cancer and prevention, endometrial cancer is easier, is more on our side, right? Is a team player, if we can say that way, because it presents with abnormal bleeding, so there are early signs. Ovarian cancer is the silent killer, right? Because often women, when they come, it's an advanced stage, because the symptoms are very vague. They mimic many other diseases. Well, it can be the the stomach or gastroenterology or bladder infections and so forth, fullness. So they're very vague symptoms. So that's the key. So even not to ignore even something
any symptom that comes on that's out of the ordinary.
Out of the ordinary, unusual weight gain suddenly, right? That can be the indicator of accumulating fluid.
Yeah, we usually think of cancers with weight loss, but as you're saying, with ovarian cancer, fluid builds up, so people gain weight sometimes because of this fluid. That's an important point that's unusual for cancers, is weight gain for ovarian. Yeah. Right.
There are certain screening blood tests for ovarian cancer. They are not always 100% accurate, but at least they can lead us to a right direction. And pain, right? Not to ignore any type of pain in the body. I think it's early satiety, so suddenly the appetite changes. And to seek attention.
Yeah, we see patients in gastroenterology in my practice where, in women, where they have abdominal pains or aches that we can't explain, and we almost always send them to gynecology for an evaluation, because some of the signs and symptoms of early gynecologic cancers, ovarian cancer, endometrial cancers, other cancers, may just be vague abdominal pains.
Sure.
Yeah, so it's important. This is why the relationship with the gynecologist, starting early and coming back frequently, to get your visits, is so important. Give us a couple of alarm features that our women watching today should look out for from Gynecologic.Health, that if they're experiencing any of these, maybe come and see you sooner than they were thinking.
Sure. Alarm, every woman knows their body, right? Even when we talk, sometimes they come and say, I have an abnormal bleeding. And then as physicians, we always think scientifically. We always want to quantify things, to measure things. But anything that feels abnormal or anything that feels is changed, right? There was some pattern there was something that felt normal and it suddenly changed. Heavier bleeding, again, any pain, any growth of the abdomen, any abnormal discharge, right? We're talking about any diseases, sexually transmitted diseases, or even cancers can present with abnormal discharges, like increased fluid coming, and so forth. So I think those are the alarm signs to any GYN.
That's some really good advice, for our viewers today. You mentioned the new unit and the help from the Brooklyn Borough President in getting funds for South Brooklyn Health here. What is the future? What is the future of women's health here at South Brooklyn Health? What do you foresee over the coming years as advances and upgrades here?
I think future is bright, and because of again the amazing team. And the team, when I say team, it's I don't know where to start. Sometimes you start from housekeeping to administration, or start with administration to physicians and nursing and housekeeping. Every day that I come in, I'm greeted with a smile from the housekeeping department, which is bright, and the floors are bright and shiny, which also is great. But future is really, I think, in first of all, simulations, right? Simulations, which means that playing all the scenarios, all the emergencies, anything that happens, to be prepared. And we are very prepared. We have amazing simulation team in the department to be prepared to anything that any patient, any disease, anything that comes through the door. We're open to the community. Future is in having easier access early in the pregnancy. Sometimes we do see patients that come in late in the third trimester, or having prenatal care or no prenatal care. So future is really helping the patients that are in need of the most in need of help to have an access to our care. Again, we're excited about new building. We're excited about continuing development of all the services and all the subspecialties of OBGYN, and having amazing providers, training the providers of the future. I mentioned residency program. We were very proud. We just had a visit, the voluntary visit from American College of OBGYN, and they mentioned that they would send any trainee or any resident to our program to be trained here.
It's a really nice
it's
compliment.
A really nice compliment.
It's an amazing accomplishment under your leadership. You know, I think that we talked a lot about women's health today. We threw a lot out there.
Yes.
The warning signs, abnormal bleeding, abdominal pains, things out of the ordinary, changes in the cycle. Come see a provider. If you're thinking about pregnancy, see the provider, see one of the obstetricians before. If you're a young woman, make sure you're getting your gynecologic checkups, your pap smears, think about the HPV vaccine. So we really covered prevention, primary gynecologic care, obstetric care, and all of the amazing services that you do here. Plus, you're teaching the doctors of tomorrow.
Yes.
It's really, you have a lot under your belt there. You have
doctors,
a lot,
midwives,
everybody,
students
a tremendous
from
team.
Yes.
Well, I applaud you and what you're doing here. It's difficult, but it's amazing work at South Brooklyn Health. So we're going to finish up with Dr. Tetrokalashvili.
Yes.
Thank you for coming here today. It was an honor to speak with you and to have you on the show. And I'm sure our viewers today really appreciate hearing all of your great advice. Thank you.
Thank you for this opportunity to send the message to our viewers.
Pleasure. Thank you. Thank you for your interest in the show and your desire to become involved and educated. I invite you to visit our website at www.zermed.com and check out our tools and connect with us on social media. You can also call us at 718-510-2103. Please stay well, be safe, have a great day. Goodbye. I'm Dr. Braha.